morning, good afternoon, folks. Sorry I'm running a couple of seconds late. Stomach's feeling a little queasy this morning, so I made myself some English breakfast tea. And I got my bucket right here beside me in case anything goes sideways on today's lecture. Hope everybody's doing well. Looks like we've got 9 people so far. It's good to see you, Heather. Etta. No, I didn't have any milk, so I just went with the tea. I'll plan better and have some cream here for tomorrow. Hi, Alex. Good to see you. Violetta. Good to see you. Heather. Lane. Hola, hola. It's good to see everybody. Hi, Crystal Bishop. How are you doing? I hope your boyfriend is looking at your. I hope your boyfriend has started looking at your Facebook posts. I saw you texting about that the other day. I thought that was quite funny. I'll have to try that, Etta. I usually don't plan far enough ahead in these situations, but I think I will. And I also spilled my tea, which is kind of nice, right over my textbook. That's fabulous. Okay, cool. So, all right. So today we're talking about the second half of Chapter 3. So on Monday we talked all about genetic susceptibilities, prenatal testing, and prenatal development. So today we're going to talk about the birthing process and postnatal tests to evaluate your infant child. Okay, Ed, I'll have to look into the Lady Gray. It's absolutely fabulous if your mom wants to come in and participate. Absolutely, I have no problem. It's not like I'm getting a sold-out audience anyhow, so I'll always take the extra participants. That would be great. Okay, fantastic. Let's go ahead and get started. So, Chapter 3, Childbirth. After completing this lesson, we'll talk about the types of settings and methods for childbirth. We'll talk about the features of the APGAR diagnostic test, and we'll talk about and other diagnostic tests, and we'll talk about what it means to say a baby is preterm, small for date, or low birth weight, as well as the consequences. Okay. Hi, Stephanie. Thanks for dropping in today. Got a good crowd, 13 people. Not bad in a class of 40. Hopefully people are watching these recorded too. Maybe, maybe not. It's up to them. Okay. Cool, let's go ahead and get started. We are on the PowerPoint presentation. Step 1, good prenatal care. The first step to having a healthy baby is to make sure you get good prenatal care. Not only are they evaluating your baby as we talked about last lecture, but they're also offering you good advice. Maybe this isn't your first time having a baby. Maybe this is your first time having a good baby. It's always good to get advice and have somebody just give you positive pointers that might help you have a healthier and less stress-free pregnancy experience, and hopefully a healthier child as a result. Okay. So good prenatal care includes regular doctor's visits that include screening for manageable conditions that can affect the mother and baby, as well as educational advice. How many of you were involved in a child and went to prenatal doctor's visits, either for yourself or with a partner? I went to all of my wives because I was just interested. I wanted to find out what was going to happen. I didn't want to miss anything. I was being supportive, but I was also being nosy because I wanted to know what's going on. Not yet, Etta. Well, if you decide one day, you may have the chance to as well. Having a baby is definitely something that you should decide on your own. Don't let society make you decide that you have to have a baby in order to fit in. I think that's a horrible reason to have a child. Have a child if you want a child. Okay, fathers are more stressed than moms. You know, right, it always seems like when you don't have control. Maybe the mom doesn't have control, but she's at least has the baby. I remember my wife and I definitely had different arguments. She told me early on that she was not going to breastfeed, and I got really bent out of shape about that. And I tried to arm her into doing that. And I had to realize that it was her body, not mine, and I did not have control, and I was worrying about things that were outside of my control and weren't really important. So yeah, we definitely do stress. And yeah, the problem is breastfeeding is a full-time job, whereas a father can help with a formula in the middle of the night. And from what I understand, children's tummies break down breast milk a lot quicker than formula, so they need more feedings. And all the females that I ever saw who breastfed their babies certainly looked a little rougher for wear after about a month. Just the lack of sleep that occurs with it. You're saying they're breasts for men now. Are you talking about the breast things that you put a bottle in? I have seen that. I'm a pretty liberated guy, but I didn't feel like going that far. I fixed the formula, I fed the baby, but I was not going to strap on a pair of falsies and stick a nipple there. I just couldn't quite take it that far. I'm liberal, but not quite that liberal. Okay. Yeah, I don't think so. Now, your book talks about centering pregnancy, which is an innovative program that provides complete prenatal care in a group setting. You know what? A lot of people don't have the money or the insurance. Insurance is a big deal these days, and maybe just aren't comfortable going to a doctor's setting. And sometimes they don't have the outside surrounding support that helps them deal with the pregnancy. So centering pregnancy is a program that was developed several years ago to include complete prenatal care in a group setting so that you could have the support of other people. Maybe you're a single mom, maybe you don't have family near you or at all, and so you need sort of a support group. So centering pregnancy actually provides the prenatal care in a group setting. Now, what you do is you go in, you have your traditional 15 to 30 minute doctor's visit, and then you have the 90-minute support group meetings and self-examination led by a doctor or a certified midwife. So usually when you go in for a well baby checkup at a doctor's office, the doctor's visit does not take long. They come in, the doctor comes in the room, they ask you a couple of questions. They may look at the baby, poke and prod on your belly for a little bit. If it's that time, they may even do the ultrasound, but you're in and out pretty quickly with these prenatal doctor's visits. So what the centering pregnancy program does is it adds a 90-minute group support meeting where you can hear other people's experiences, maybe hear things that make you feel like you're not so alone, get support ideas from other people, and then you even take a little control with self-examinations led by the doctor or the certified midwife. Usually there's up to around 10 other mothers, and it usually begins at 12 to 16 weeks of pregnancy. And as I said, the goal is self-empowerment. Maybe people who come in here don't have the support that helps them feel comfortable and strong in their pregnancy. So this group setting sort of gives you the ability to take on a little more control, which decreases your level of stress, which helps your developing baby. Now, because it's such a positive experience, it does seem to increase the number of prenatal visits by moms, which is a good thing. You have to go to your doctor's visits in order to get any help from your doctor. If you go the first time and then don't go back, that's not good. So this seems to increase the number of prenatal visits, which is always a good thing. Again, it reduces the stress. It makes you feel like you're not so all alone. It allows you to ask questions and get answers from other people who are in the same situation as you do. So it gives these mothers a more positive view of the pregnancy, which is a good thing. And of course, it increases the rates of breastfeeding, which your book is going to say a good thing. Again, because of my own experience and how I made my wife feel, I feel strongly that maybe if it's not your baby, if it's not your body, you shouldn't press the mothers to breastfeed. Breastfeeding is a good thing. It does carry some immunological benefits for the baby, but it is definitely up to the mother to do that. You know, having a baby is the hardest thing you'll ever love. It was totally scary. I remember when I walked out of my wife and I walked out the door of the Cary Hospital with our baby. I was absolutely shocked and dumbfounded that somebody was fool enough to give me a baby and let me walk out with a baby. It is definitely a stressful thing. But you know what? It's fun, especially if you have somebody who's a good partner working with you, I think. Now, it's good to exercise during pregnancy. Now, if you're not an exercise person, this is not the time to take up long distance running or weightlifting. But if you're a regular exerciser, you definitely should continue on with moderate exercise. Seriously, no running marathons, no trying to max out your bench press or your deadlift while you're pregnant. But definitely you want to get that heart rate up a little bit and get just a sort of get that blood moving through the system. It helps regulate your blood pressure and reduces the risk of hypertension. You know, a lot of moms do have maternal hypertension. My wife went through that as well, and having high blood pressure, from what I'm told, is a risk factor in a pregnancy. So you want to avoid that if possible. Conditions the body, controls weight gain. You definitely need to gain some weight with your baby, but you definitely don't want to gain too much if you don't have to. You need enough weight to take care of your baby, but you don't want to make it even more difficult for yourself after the pregnancy. And exercise and reduces stress, which improves immune system functioning. Right? Well, I do have a friend who was one of those powerlifting competitors, and I remember when she got pregnant, we had to tell her that she could not be going down to the gym working on her snatch and grabs pregnant with a baby. And she was kind of maniacal about that, as are some people who like to lift heavy weights. So we had to chill her out just a little bit. It's going to be the new labor routine. Right, funny comment, Crystal. Also, anything that helps reduce stress, they say yoga certainly reduces stress. It's associated with a more, and yoga, I've tried yoga. I thought it was easy. My wife, when she was in her routine briefly, she took me to a couple of her yoga classes. I thought that I was going to chill out. I was already doing cardio and lifting weights. I was like, oh, this is going to be easy. Turns out yoga is not as easy as it looks. Holy cow, it was a bit tough. But it's definitely good for reducing stress and improving the immune functioning. And all of this is associated with a more positive mental state, less stress, and it leads to less problems, which would result in non-vaginal vaginal births. And although C-sections are okay, it is a surgical procedure, and there are risks associated with any surgical procedure. So if you don't have to have a C-section, anything you can do to decrease that risk is a good thing. And it also helps the development of the neonatal brain. Crystal, yeah, I thought it was a joke. Not a joke at all. Holy cow, not a joke at all. Definitely tough. So kudos to you, Crystal, for doing it for 18 years. Now, comes the big day. I remember my wife developed this horrible rash on her body. She had that and terrible heartburn. Those were sort of the two things that were characteristic of her pregnancy. And I remember towards the end of her, and she happened with both babies. And I remember every night she would get in the bathtub in hot water, and she would get in an oatmeal bath, and I would pour the oatmeal bath on her huge rash that she had all over her belly. It was so itchy and painful for her. And I would just apologize. I can't believe I did this to you. I'm so sorry. And we did that every night to try to help her not suffer from this bizarro rash that she had. Now, the crazy thing is, 6 hours after the baby's born, the rash disappears magically. But she had it for both of our babies. And I remember the oatmeal bath every night and me apologizing because I felt so horrible about what I'd done to her. And I remember we went out we went to the doctor, and the doctor said, oh, it's sometime this week. And we went out and had our last dinner out because we knew it was going to be stressful. And I took her to a Mexican restaurant, brought her home, and then we're doing the bath. We're doing the bath and the oatmeal bath, and she gets out of the bath, and it's about 11 o'clock, 11:30 at night, and I'm getting ready for a nice night of sleep. And all of a sudden, her water breaks. The amniotic sac ruptures, and it shocked the hell out of both of us. And I was like, oh my God. And so we drove from Apex to the Cary Hospital. Of course, I was your typical father driving like an absolute nut job on the empty road down 64 to the birthing center there at the hospital in Cary. And so we went into the birth process. Now, it turns out there are 3 stages of childbirth. The first stage is when the contractions start. And they start, and they're not as bad, and they start 15 to 20 minutes apart. And as you progress through the first stage, the contractions become stronger and become more close together. And what they're doing is they're opening the cervix, which starts out this small, 1 centimeter, all the way to about this big. So the bottom, the cervix, the bottom part of the mom's uterus, is actually opening to allow the baby. So these muscle contractions are kind of pushing the baby down the birth control and opening that uterus. Not a fun time for most mothers. Now, the first stage can last any amount of times. It's 6 to 12 hours for first-time mothers. For my wife, it was approximately 10 hours. Now, I have a friend who's had 4 children, and by virtue maybe of luck and by multiple births, my friend's wife labored in the first stage of labor for about 45 minutes with her last baby. It just happened super duper quickly. Her cervix opened right up, and they're waiting for you to get fully dilated. And that represents the first stage of childbirth. The second stage, and here's the thing, when you go into the hospital, I thought that the OBGYN was going to be there with us through the entire delivery. Not true. Not true. The doctor is kind of like the superstar that shows up during the second stage. So if you're there for 6 to 12 hours, you will not see the doctor. You will see nurses that will come in and try to make you feel comfy as they possibly can, but you are not going to see the doctor until the second stage of birth. I can do without children in general. Well, I get that too. All of it sounds terrible. But you know what the weird thing is, Crystal? You totally forget it afterwards, which is the only reason that second babies are born. Because if the mother remembered how much it hurt, there's no way in hell they would ever do this again. Now, when we got there, they want you not to use medication. So they don't want you to use the epidural block as a general rule. The doctors seem against that. And so they drugged their feet with my wife on our first baby until these dilation. They told us, I don't know if this is the true, but they told us after you're halfway dilated 5 centimeters, it's too late to do a spinal block. And so the person that was supposed to do the spinal block drugged their feet until it was too late. And my wife was forced to go through a natural childbirth. And she cussed me and the doctors and the hospital the whole time. Now, when we went back with the second baby, my job was to go tell the nurses, hey, look, you better get the freaking epidural person in here right stinking now, because we're not going through this again. And my wife's second birth was much, much easier. So yeah, it can be yeah, my wife had a forced natural childbirth. I don't think that was cool. Now, the second stage usually takes 45 minutes to an hour, and this is when the baby's head starts to move through the cervix and the birth canal. Usually lasts 45 minutes to an hour, and this ends when the baby completely emerges from the mother's body. Now, if the baby's having trouble getting through there, the doctor may go in with forceps, salad spoons look like to me, and try to pull that baby out. Or the doctor may even attach a suction cup onto the top of the baby's head and pull it out. Now, these are non-optimal strategies because the forceps can cut the little baby's head, and the suction cup cannot. The baby's heads are pretty flexible. The bones aren't set so they can pass through the birth canal, and so it kind of misshapes the head. Neither one of these are permanent problems, but as a general rule, I don't think the doctors like to start with the forceps or the suction cup. Yeah, right, I know. CJ, the first one, my wife was so tired, and you know, the crazy thing was, because they didn't do the epidural, my wife complained. They started giving her oral painkillers. And I forget exactly what they gave her. It's been 21 years now. But she was so stoned by the time it came to the second stage that my wife was just too high to push. And so CJ, Chris Jr., had trouble being born, and they had to go in there with the forceps and pull my son out. And he did have 2 little marks on the side of his head where they kind of scraped him as they pulled him out. So the first baby was non-optimal at all. Now, that's not the end of the birthing story. Holy cow, I did not know this, never thought about it. But pretty quickly after you've got that beautiful baby out there and the nurse is cleaning it up, the third stage of birth starts, which is the afterbirth. And that's when the placenta, the umbilical cord, and all the other membranes inside the support structures for the baby are detached and expelled. This happens pretty quickly. It is not painful, but holy cow, it is gross. No, I did not cut the umbilical cord. I have too weak a stomach. Absolutely not. In fact, I wasn't even going to watch the childbirth because the whole thing just grossed me out, Etta. But my wife was taking so long, I found myself, after a while, looking like this, going, when the hell is that thing coming out? You know what I mean? But no, I did not have the nerve to cut the umbilical cord. It's a big, thick, purpley, gruesome-looking thing. No, I did not. I just focused on the baby. I was 31 years old. I was 30 getting ready to turn 31, and my wife was 28. I was actually ready to have babies. We were married about 6 years before we had babies. I was ready for babies at 25 and 26, but my wife was like, hell no. She wanted to get her career started first. And, fine, good enough. And so we waited 6 years. We planned it. We did everything, got all the stuff. We planned our first baby out so perfectly with CJ planned. And I remember CJ was about 5 months old, and it was a winter night, and we were sitting on the couch nursing this baby. We were both so tired. We were broke. It was so stressful. And my wife said, I'm late. And I remember turning to her and I said, late for what? And she looked at me and said, late for my period. And it just hit me. I was like, oh my God, not a second baby. And so I remember going down to the Food Lion, and I got myself a 6-pack of beer and a pregnancy test. And I came back, and I remember drinking 2 beers before we took the pregnancy test, and it immediately came back positive for a second baby, and my wife and I both cried that night. We were so freaking overwhelmed with one baby, and we knew we had a second one coming. Both of my boys were born 16 months apart. CJ perfectly planned. Zachary was an oopsie surprise. And now I wouldn't have it any other way. But I remember when we had 2 babies in diapers, I was in graduate school, so I was making $0. My wife was supporting the family. It was the worst thing ever. But yeah, it was shocking. Honestly, if we'd allowed to wait until we were ready for the second one, I'm not sure we'd have ever had a second baby. And I so love Zachary that I'm glad we made that mistake. And they were so close together that they played together, fought together. They were really close brothers. So it actually worked out well. But it was certainly shocking and stressful at the beginning. Exactly, Heather. Everything happens for a reason. So, and I am so glad that it happened because I got to see them play baseball on the same teams, and they were such great playmates. It was fun. Now there was all this cooperation, and anytime that CJ, the older one, got something, his younger brother thought that it was his birthright to get that the same way. So when the older one got a nice baseball glove, his younger brother had to have one immediately. When my older one got his first cell phone, my younger one thought he had to have his cell phone. When my older one got his driver's license, I had to explain to my son, hey, look, it's not up to me. The state of North Carolina says you can't get a freaking driver's license, son, so you're just going to have to wait that extra 16 months. And he was so angry about it. But he did go out and get a job immediately. He got a job at 15 working at McDonald's, because if his older brother was working, he wanted to be working too. They were so competitive. It was funny at times. Okay, now in the United States, 98.5% of births take place in hospitals. Of the 1.5% that take place outside of hospitals, 63% of them are at home, and 31% of them are at birthing centers, where you're going to see the midwife and the doula. Birthing centers are not attached to hospitals. Now, we gave birth in a hospital, the Cary Hospital. Now, they had a little place at the hospital that they called a birthing center, but it wasn't a birthing center per se. It was the delivery area inside a hospital. By a birthing center, I'm talking about a freestanding building that is nowhere close to it's close to the hospital, but it's a mile or 2 or 3 miles away. It's not attached to the hospital. And, there are positives and negatives about that. Now, the thing is, a lot of people think, right. Here's the thought process. Having a baby is natural, and we've been doing it as long as humans have been around. And so it's not a medical procedure, but by having them in hospitals, somehow in everybody's mind, we think of natural births as being hospital or medical procedures. But there are people, my wife is not one of them, who would say, why do you need to go to a hospital if you're not sick? You're having a baby. You're more comfortable at home. Have that thing at home. If you want to go to a birthing center where you can get sort of a more well-rounded, holistic approach, you should go to a birthing center. And that really is up to you. You're right. That's a good point. With COVID, maybe you don't want to go to a hospital. This is true. I have an in-law family member who died of COVID last week, and she had been going to the hospital multiple times for an unrelated illness, and they think that she actually caught COVID on one of her hospital visits. So ironically enough, it was going to the hospital that may have wound up killing her. So that is a good point, Stephanie. Yes, yeah, I know. It sucks. She wasn't that old. She was in her early 70s, so it shouldn't have happened. But, it's one of those things. I know. So, not all births need a medical doctor. Now, I watched a YouTube rant video from a midwife last night. I was going to share it with you, but it was more of a personal rant, and she went off the rails in some places on things that didn't line up with what your book said, so I didn't want to present it to you. But she talked about the differences and advantages of going to a birthing center and using a midwife. Now, she argued, you're not sick, why go to a hospital? If you have a low risk pregnancy, if the mother's younger than 35, if there are no health problems, if there are no prior medical problems of the mother, if the mother is in perfect shape and the baby is in perfect shape, you can go to a birthing center. Now, you don't have the full support of a hospital, and you don't necessarily have the full support of a doctor, a medical doctor, but what you do have is a midwife there. Now, as I told you earlier, the doctor doesn't show up until the last minute to deliver your baby. Instead, you have a nurse. If you go to a birthing center, you will have the midwife the whole time you're there. So in stage 1, when you're going, if you're that kind of person that wants a medical support while you're going through stage 1, the contraction process, you go to a birthing center, the midwife, at least as this midwife said, she will be there the whole way, providing support and confidence to you and helping you, exactly. In fact, I talked to a doctor when I was in the hospital many years ago, and we had a conversation about new doctors, and the doctor told me that this fellow told me that he would rather have an experienced nurse than a new doctor treating one of his patients. There's nothing like experience, and you are definitely right, Crystal. So, do you still get the painkiller in a birthing center like you do in a hospital? Wow, that's a good question. I think in the birthing center, I'm not sure if they do epidurals, and somebody might know that. But I think in the birthing center, that's usually for the people who are choosing to go through some sort of non-medicated birth. And so that's a very good question that I don't have the answer. Very good question, Davina. I will look it up after class. Okay. Now, for low-risk pregnancies, the use of midwives tends to be associated with by increased satisfaction in care with no adverse outcomes. So no worse outcomes, but there is increased satisfaction. Now, the thing is, there are much higher rates in other countries for the use of these midwives. So you will find some midwives at hospitals. 8% of them will be at hospital births. 8% of hospital births will include a midwife. But you're going to see midwives much more common in other countries. And I'm not sure if all countries are like this, but I know in the United States, we tend to treat it as a medical procedure. Leanne asks a question. Yes, typically these places are going to be close to a hospital in case something happens. If something happens, be sure you're not at a hospital, so you have to get to a hospital. But most of these places are going to have some sort of contingency plan in place. But if you want the comfort of knowing you're at a full-service hospital, then you go with the hospital. And I talked with my wife about it, and she is sure just as positive today as she ever was that she wanted to have her baby in a hospital. Okay, exactly. A lot of people like the comfort of having lots of medical doctors around and an ER and all the other things that can occur. I remember with our second baby, my wife wasn't contracting as much, so they started to give her Pitocin, which is a synthetic form of oxytocin, which helps the contractions. And as they gave the Pitocin to my wife to help stage 1 of birth, Zachary's breathing and blood rate started to go down, and so they actually had to stop the Pitocin because it was affecting him as he was trying to be born. And those are the kind of things that make you nervous as a parent, make you want to be close to a doctor's care. Now, they also have doulas. Doulas are not as highly trained as midwives. Excuse me, they probably don't have the certification such as midwives. But they are the doula. Some women like to have doulas, which is sort of a caregiver who provides continuous physical, emotional, and educational support for a mother, all during pregnancy and even after the childbirth. And you're going to find doulas sort of as support people for midwives. And they can be part of the birthing team that's led by a midwife or a doctor. Whether or not you choose to use a doula is up to you, and it's probably something you have to negotiate with your doctor or midwife. Good point, Crystal. That is the reason why, one of the reasons why we live to be older. Right? I think your nurses are going to have more general training that is of more use in more settings, whereas your midwife their training is going to be limited to those nursing practices specifically related to the childbirth process. So a nurse can probably do more things for you than a midwife can. Now, that's not to say a midwife is not properly trained in all of the things that relate to the birthing process, but they may not have the clinicals, the well-rounded clinicals, like the nurse does. Okay. Now, different ways to give give birth. The medication. A lot of mothers opt for medication. Some of the things that they'll give you. The epidural block is a regional nerve block. They stick a needle in your spine, and basically it numbs the mother below the waist. Now, it's sometimes because the mom doesn't feel and doesn't contract as strongly, it may you may have the increased use of tools like the forceps and the suction. But according to my wife, it was much more comfortable, much more comfortable. Now, if you don't use the nerve block at the right time and they have to give you pain meds afterwards, they will be oral pain meds such as tranquilizer, barbiturates, or Demerol. You know what, now that I'm thinking about it, I think they gave my wife Demerol. And like I said, it made her kind of high and she was just not focused when she needed to be focused. And so those are sort of the pain meds that they're going to give you. And then, as I told you on the last slide, my wife was given Pitocin because when it's time for the baby to be born, they need the baby to be born. And so they gave my wife Pitocin in a synthetic form of oxytocin, which speeds up the first labor. Now, like I said, they're measuring the baby's heart rate and breathing the whole time. And if the Pitocin starts, somehow or another, the baby's vitals start going in the wrong direction, they're going to remove the Pitocin, as they did for my wife. Oh, wow. Davina, I should have done more research. I'm assuming it's going to be, you know what, I'm not going to say. I will have that answer tonight, Davina. Stay tuned and come to webinar tonight at 8 o'clock for the answer. Okay. All right, so natural childbirth. There are other ways that are designed to avoid the need for medications during birth. There are always, anytime you're doing a nerve block, you're sticking a needle in the spine, and if you're giving the mom pain meds, those are drugs and those are things. The complications are small, but they are there. So if the mom can get through it without these meds, it can be better. And so your book talks about natural childbirth and Lamaze method. In natural childbirth, and when we went to our birthing classes, and we had what I like to call a birthing Nazi. She had her beliefs about how it should be done. You should not use drugs. You should use a midwife, and she just had all these rules, and she was really pushing the natural childbirth. And one of the things that she did was she sat down and she explained to us exactly what was going to happen. And then we did practice relaxation techniques during these classes. And she enlisted us fathers to be parents as partners as a birthing coach, helping the wife get through the process. And the idea is if you know what's occurring and you know how to relax, maybe you can mitigate the pain and make natural childbirth a better option. Yeah, good point, Crystal. It's always a guy thinking about how guys really shouldn't have any opinion on what happens in childbirth. I would agree with that. And I remember like the 7th week of pregnancy, this birthing coach, it was pizza night, and we all chipped in and brought pizza. And she's like, I'm going to show you a movie while we eat our pizza. And I remember asking her, I was like, dude, you are not going to show us a childbirth, are you? Not going to show us anything gross. And she was like, no, it's going to be beautiful. It'll be fine. It won't worry a bit. 5 minutes into pizza, man, there's a crowning baby's head coming out of a mother's vagina. And I'm like, seriously, you did this on pizza night? It was absolutely awful. But it was definitely, she was a big advocate of natural childbirth. Now, there's another method, the Lamaze method. You've probably heard of the Lamaze method, and that's the one where they teach you how to do the breathing technique. And of course, they give you the education. They're showing you what's going on down there. It's like an anatomy and physiology coach. And again, you have the partner as birthing coach who helps you remember to breathe. Because frankly, when you're contracting, breathing is not the first thing on your mind. In fact, I would say our birthing coach kind of did a combination because she did work on breathing techniques as well as relaxation techniques. But the Lamaze method really focuses on this breathing technique and having the husband help you have the breathing technique. Now, for some reason, the baby may be in breech position, or maybe the mom's just not contracting out to the right size, or the baby is in dire straits, and they may have to go in and do the cesarean delivery. And what they do is they make an incision in the mother's belly, and they go into the uterus and pull the baby out through the uterus. It's used in case of breech position baby, fetal distress, maternal vaginal bleeding, or if the natural birth is hindered by an epidural. So in cases where the baby's in danger, the mother's in danger, they're going to use the cesarean delivery. Now, there is a debate over the benefits versus the risk. It is a surgical procedure, and there are always risks avoided with surgical procedures. And if a mom has a cesarean, for the first baby, it's more likely she's going to have a cesarean for the second baby. And the rate for cesarean deliveries is much higher in the United States than it is in other countries. Wow, 4 C-sections. Holy cow. They cut you long ways, right? Not up and down. It's long ways, so it kind of fits in with the folds of your skin, correct, Heather? Yeah, okay. I don't have a lot of experience, so I had to ask you for your opinion. Okay, now once your baby is born, they're going to take their first test within 5 minutes of being born. The APGAR test, developed by a lady named Virginia Apgar, assesses the health of newborns at 1 and 5 minutes. Because one of the things when your baby is born, they need to know immediately, does that baby need to go to ICU? Most babies don't, but some babies do, and they need a way to systematically and quickly find out whether or not that baby needs life-saving care. And I will tell you, it has to be simple, because the delivery room is chaos right after that baby's born. You got family members, you got the mom, you got the freaking out dad, you got the nurses running in and out. It is absolute chaos. So what they do is they have a 5-point test that they give your kid, and your kid can score 0, 1, or 2 on each of these five qualities. How fast is their heart beating? Are they breathing and crying? Is the baby moving around, or are they kind of limp and flaccid? Is the baby blue, or is the baby pink? They will stick this little sucker in your baby's throat to try to suck the fluid out of their throat, and they want that baby not to like that. They want the baby to grimace and cough and sneeze and not like that. And so if your baby's got a fast heartbeat, they're breathing and they start crying, and their little arms are like clenched up and they're really pissed looking, and their entire body's pink, and they're coughing, sneezing, and crying, that is a sign of a healthy baby. On the other hand, if your baby's heart rate is absent or slow, if their breathing is real slow, if they're a limp baby and their arms are blue, or their whole body is blue, or they don't really have a reflex response, that baby is in danger and needs to go to ICU immediately. Typically, the doctor wants a score of 7 or better on this test. So you can score up to 2 points on each one of these. And so it has to be right, shake forcefully, but lightly. And so what they want to see is scoring 7 or higher above is reassuring to your doctor. If they don't have that 7, they're going to keep doing that test every 5 minutes until that baby number goes up, or until they think that baby needs to go into ICU. If your baby scores a 4 or lower, they are going straight to ICU, man, super duper quickly. That is not a good number that your doctor wants to see. Okay? Yeah, good plan, Crystal. Good plan. Now, that's not the only test. That's the test that all kids get after birth. Now, testing requires a professional. Professionals require money, and so your insurance company isn't really going to pay for these alternate tests. However, there are alternate tests that are usually used either a couple days after birth or up to a month after birth. And these tests are designed to evaluate your child's neurological and emotional development within the first couple of years. The Brazelton, the NBAS, is used a lot in research to test the impact of pteridine exposure. So babies who have been exposed to pteridines, we want to see when we can assess whether or not they have been affected by these pteridines. So a lot of research is done with the Brazelton. It's typically used to assess normal, healthy, full-term infants to see if teratogens have affected them. It tests your reflexes, your startle response, how cuddly the baby is, how organized their motor behaviors are, and their ability to habituate to new environmental circumstances, like something they might see, feel, or touch. Now, typically, and another one that they used that really is kind of the same thing. It's used for children at risk because of prenatal exposure, and it also has research applications, is the NNNS, the Neonatal Intensive Care Unit Neurobehavioral Scale. And it looks for behavioral organization. And next week, when we start talking about the behaviors that newborn babies can do, this will make more sense. But it looks for your baby's ability to engage in some reflex behaviors that they should have, and their ability to move body parts. And it also looks for their ability to handle stress responses, so things that happen to them. And sort of the measure of your socio-emotional development is your ability to habituate, your cuddliness, and your ability to regulate to new environmental stimuli. Okay, babies smell absolutely wonderful. Oh my God, after they clean that baby up and hand it back to you, it is the most awesome thing in the world. And you know what? I think that is evolutionary, because if babies weren't so damn cute and smelled so good, we would probably throw them out after we had them, right? And in fact, we're going to talk about that in a couple of chapters, the value that the attachment process has on making babies and parents like each other. Because babies are born extremely helpless. They need tons of help for the first several years of their life. And if they weren't so cute and smelled so good, we wouldn't give them the effort that they need. Okay, preterm and low birth weight babies. Oh my goodness, low birth weight. If you're below 5.5 pounds at birth, you're a low birth weight. Extremely low, 3.5 pounds. Very low is 3.5 pounds. Extremely low, 2 pounds. Preterm infants are born before the completion of 37 weeks of gestation. Now, if you're not at 40 weeks, of course you're not going to be at 7 pounds, which is the average birth weight. You're going to be a little bit smaller. But you can also be small for date or gestational infants. So if your birth weight is less than what it should be for you for a 35-week-old baby, you might be small for date. And that considers the length of the pregnancy. Now, what we know is low birth weight babies, not to pigeonhole anybody, but low birth weight babies are more likely to have health and cognitive problems than children of normal birth weight. This is such a problem even that mothers who are addicted to opioids are put on maintenance programs rather than having them quit cold turkey, because sometimes quitting an opioid cold turkey makes you go into makes the baby be born earlier at low birth weight, which we do not want to have. If your baby is born a low birth weight, what can we do? Well, doctors now suggest what we call kangaroo care, which is you put the baby right next to your skin and hold them there for 2 to 3 hours a day. See this mom below me snuggling her baby, and that warm skin-to-skin contact appears to help the baby grow and develop, and it mitigates some of these problems. Now, the long-term benefits of that is that the baby's going to breathe better, their heart functioning is going to be better, they're going to sleep better, and their cognitive functioning from age 6 months to 10 years is going to be better. Now, still, it's not going to make up for being a low birth weight baby, but it helps, And you know what? It helps later down the road. They say that babies, low birth weight babies who go through kangaroo care have better social skills, reduce school absenteeism, hyperactiveness, and aggressiveness. Yes, the job is super duper hard. Okay, now after you're born with a baby, yes, you are going to be stressed out. You've had the hardest 9 months of your life, and now you've got a baby. It only gets harder. You're thinking, holy cow, pregnancy was bad, and now this. And you know what? It's definitely a 6 to 8 week regeneration. And it not only is it physical as your body goes back to its normal state, but it's also emotional and psychological. There's a lot of stress bringing a new baby home, especially when you don't feel good. The mom may have had to take off from her job without funding. And so there's a lot of stress that goes on with the mom. And so there are things you have to deal with. So The estrogen and progesterone levels drop steeply when the placenta is delivered and remain low for this first couple of months. And so the ovary is going to have to start producing these hormones again. So this leads to the physical effects. Now you're also dead tired because you just gave birth to a baby, and now you have to stay up in the middle of the night taking care of that baby. Your husband's going to help, your baby father's going to help you hopefully with that, but there's going to be a lot of fatigue. And this is going to affect your sense of well-being and your ability to cope with the new baby and family life. It contributes to stress, arguing with the marital partner. Hey, it's your turn to feed the baby. No, it's your turn to feed the baby. It's your turn to change the baby. No, it's your turn to change the baby. And you have to have it really helps if you have a good partner to help you negotiate these things. The dad can't help unless the mother uses the breast pump and refrigerates it. And that's a lot of hassle in and of itself. You're right. And so maybe that's what my wife was thinking. But honestly, I didn't mind feeding my babies. In fact, as our babies grew up, because I had the community college job and she was a hotel manager, I wound up being Mr. Mom, doing all the doctor's appointments, most of the diaper changes. I was a super duper good dad. Y'all would be proud of me. Finally, postpartum depression. Now, everybody's going to feel the postpartum blues. Dude, you just brought this new baby home. You're freaked out and scared. Of course you're going to be a little bit depressed for the first week or so. If it lasts longer than a couple of weeks, you may have postpartum depression, which is the sadness, anxiety, and despair that comes with having this new baby. Holy cow, it's difficult. And it's going to cause difficulty coping with daily tasks in the postpartum period. When that baby cries, you're going to feel overwhelmed. When that baby poops their diaper, you're going to feel overwhelmed. Now, these feelings, if they don't go away after the first couple of weeks, you may have postpartum depression. Now, what are some risk factors for having postpartum depression? Mothers who are depressed and anxious during pregnancy, if they have low self-esteem, if they have a poor partnering relationship or lack of social support, or just a history of depression. These qualities are going to make a mother more likely to have difficulty with that baby after birth. Now, being depressed, it means you can't be as good a parent, and it's going to have impacts on your child's emotions and behaviors. And you know what? If the dad's experiencing depression and can't help, that's going to work against you as well. And if both parents are depressed, this is really going to affect the baby's ability to bond with you. Babies bond with you and want to hug with their parents because that makes them feel comfortable. Babies cry and they can't control their emotions. They look to you to calm them down. But when you put a baby against you, they can feel your heart beating fast. They can feel your stress. So if you're stressed and depressed, when you put your baby against you, it's not going to provide the comfort that that baby needs. Does that make sense? So really, the one thing you want when your baby is crying is to remain as calm as you possibly can. Your baby doesn't want to hug an anxious or nervous person. They want to hug someone who is calm, who makes them feel calm. Okay, I have kept you longer than I meant to. I am so sorry. Folks, I will see you tonight at 8 p.m. Where we're going to talk about, I forgot what we're talking about. I've lost it in my mind. We're going to have a cool talk tonight at 8 p.m. Remember to bring you a beverage of choice. I'm going to bring tea because my stomach's feeling a little bit nauseous. And don't forget to do the videos before you get there, so we'll have a good conversation. Does anybody have any questions? If you don't have any questions, I'm going to go ahead and log off for the day. It's good to see everybody. Thanks for coming to, oh, there you go. Edda's going to do some shopping too, and she's got her fridge full of fine craft beer. Fantastic. Leanne, you will bring soda or tea just like your teacher tonight. And have your mom come along. We'd be more than happy to have her join in the conversation. It was great seeing everybody. Thank you for coming today. You really don't know how much I appreciate you attending my lectures live and adding to the conversation. It really makes me feel like I'm teaching a real class, and I get just as much out of this as you do. Okay? So have a good day, and I will see you tonight at 8 p.m.